what are some of the common tests that you use to rule out other conditions that help it be supportive of a CVS diagnosis?
Yeah, so when I see a patient in the clinic, I like to get, even if they're well, I like to get baseline blood tests, including blood count, liver tests, pancreas tests, and also celiac disease. Those can tell you a lot, just to make sure you're not missing any of those. Then I will typically do an upper GI series, which is have a patient drink some barium, take pictures of the stomach. That's to make sure the stomach is in the proper position and there's no twists in the intestine. I will often do an ultrasound to rule out gallstones, kidney stones, or a rare condition called UPJ obstruction, where urine has trouble flowing out of the kidney. And then sometimes, but often, I tend to have a low threshold for doing this, especially in a young child. I will sometimes do an MRI just to make sure there's no cyst or tumor in the brain. Many of my colleagues say that's probably overkill, and that's okay. But I'm not quite as comfortable with my neurologic exam, especially in a toddler. It's maybe some of my colleagues are. So I will sometimes do a brain MRI. And then for patients who, are having recurrent episodes or frequent triggers, I will have them come during an episode to the emergency department, and we do a large number of blood tests during the episode to rule out what are called metabolic diseases.